Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Hi, I'm Dr. Lori Spuzak. I'm a gynecologic oncologist and a palliative medicine doctor at the University of Kansas Cancer Center. And today I'm sitting in for Dr. Roy Jensen. Thanks for joining us for today's episode of Bench to Bedside. With me is Lizzie Wright, the adult program manager at Turning Point, and Lindsay Norris. She's our clinical nurse coordinator for breast surgical oncology and a colorectal cancer survivor. Today, we're going to be focusing our discussion on how to support loved ones with cancer. This time of year can be especially stressful for cancer patients, and our experts today can help provide recommendations on how to help your loved ones with cancer. So thank you so much for both of you being here with us today. Lindsay, I want to start out with you by highlighting a very special award that you were honored with this year, the Magnet Nurse of the Year Award. So can you tell us a little bit about this award and why you were nominated for it?
Sure, thank you. So the ANCC each year chooses 5 nurses throughout the nation to honor with the National Magnet Nurse of the Year Award, and I was very honored and lucky to receive the Structural Empowerment category award this year. And just kind of derived from my blog and some speaking engagements that I had, and I'm so very lucky to have the support of the University of Kansas Cancer Center and Health System to really just help me share my story, share stories like mine, to try to give a face to the cancer patient and really just try to bridge the gap between oncology nurse and oncology patient. So.
This is absolutely fabulous, and I can tell you that I know from patients that have shared their stories about you and knowing you, working with you both in the clinical environment but also on a personal level, you've made tremendous differences in our patients' lives. So we are so grateful that you're part of our team, and congratulations.
Thank you.
So yeah, thank you so much. So Lizzie, can you tell us a little bit about Turning Point and what types of services Turning Point has to offer for our patients?
Absolutely. So Turning Point's actually been around since 2001, but became a department of the hospital in 2012. And we provide programming for people who are living with a serious or chronic physical illness like cancer, although it doesn't have to be just cancer. It could be heart failure, diabetes, autoimmune disease, and then their primary supporters are also welcome to access our programs. And we have weekly programs like yoga and meditation and Tai Chi, and then we also do programs that provide an educational component so that teach people how to live better with their disease, such as relaxation techniques, self-calming tools, things like that, and really bring them together with other people who are also dealing with an illness to get that support from them as well.
So I think Turning Point is fantastic, and it's benefited so many of our patients. Mm-hmm. And Lindsay, you're a clinical nurse coordinator for breast surgical oncology and a Turning Point participant.
Yes.
And I learned that both of you used to work together because also Lizzie, you were a social worker at KU prior to becoming the adult program director at Turning Point. So you have a lot of overlap between the clinical world and the patient experience. So tell us a little bit about your experience as a patient at Turning Point.
Yes, yeah. I had been referring patients to Turning Point for years and knowing all of the wonderful services they provide, but was embarrassed to say that I never really made a visit myself until I needed the services myself. So I do encourage the staff to really look into what they can offer and all of the resources available. Myself, when I was first diagnosed with cancer, I had a 3-year-old and a 5-month-old child. So my first thoughts go directly to my children and how are we going to get them through this, and how am I going to explain all of this? How am I going to prepare them for how much their world world is about to change. And so one of the first things I did was call Annie, the Turning Point child life specialist, who was so welcoming and so helpful. And she just kind of helped me process that with her to say, how should I explain this to my 3-year-old? And she offered to have a one-on-one session with him. So he went in and talked with her and did some play therapy, which he just loves. He still points it out anytime we drive by. He goes, there's Turn Point. And he just really felt welcomed there, and was able to kind of process his own emotions throughout my cancer journey there. And he even got to participate in the free summer camp that they have for kids with, who are a child of a parent with a chronic illness. And so he's really benefited a lot. And of course, my daughter was a little too young to kind of understand, but I was able to get the information from them to how to prepare them differently to an illness. And I just happened to have a kid that really wanted all the details, so they really helped him with that.
It's so incredible to me to hear that a 3-year-old perceives that
Sure.
something scary is happening, that something is changing. And it's pretty unusual to have services available for children and families.
Yes.
So it's a huge resource that we have here through Turning Point. And it's so wonderful to hear how supportive they were to you and your family.
He would have questions just saying, like, is it dark in surgery or is it light in surgery?
wow.
And he was just really trying to figure it all out. And so through the play therapy at Turning Point, he was able to kind of see their little setup, their medical room setup, and their surgery setup, and he was able to process that. So I can't thank them enough for that.
It's absolutely incredible.
And I think I forgot to mention too that everything is free if you're eligible. We're funded by some generous donors, but that's something we didn't want to have people have to worry about, was the financial stressor piece.
Right.
Sure.
You can
They just have to get there.
have to get there.
right?
Yes, yes.
A car, a bus, something.
Absolutely.
something
Yeah.
to get there. So the holiday season is upon us, right? So Lindsay or Lizzie, what advice do you offer patients in active treatment around the holiday season?
Sure. So I can relate to this. When I was first diagnosed, it was in September, so the holidays weren't far behind. I was in active treatment through the holiday season, and my biggest pieces of advice is don't let yourself feel that pressure of the holidays. And I know that it's hard, but if you're that person that made 3 pies and hosted 20 people, it's okay if it looks a little different this year. And if you're that person who was, doing everything else for your family, or maybe traveling 10 hours to go somewhere else, it's okay if that doesn't happen this year too. I encourage people to hold on to those traditions, but they can look a little bit different, and to just not really put all of that pressure. And sometimes it's okay to skip something too, and really just lean on your family and friends to kind of, help make it what is going to be best for you.
How about you, Lizzie? Any advice that you give your patients?
I think just delegating is hard. It's really hard to ask for help. It's hard for people to get to Turning Point because that's asking for help in a way, and nobody wants to be able, we want to be able to do it all. But I'd say delegating is big. And if you're hosting somebody with that's affected by cancer in some way, whether it be the person living with it or the caregiver, just to ask them, like with food, like what sounds good, have maybe some pretzels or crackers out just to have some bland options, and then calling ahead and being like, what's tasting good to you? And also, I know we talked about smells too. It's a big like pine scented, apple pie candles burning,
the
and
holiday scents are very strong, and it can be very nauseating.
So being mindful of those kinds of things, and putting those away for the time being. But
it sounds like what I'm hearing is not only for the patients but also family members to not feel upset or offended or put off by special requests, and also to be really sensitive to the needs of the family members that are around them, that are walking through treatment, and things that they might not be able to anticipate, and they may not be available. So it's not just how the patient experiences it, but also the expectations of the family and how the family can can show up for a patient in different ways, right?
Yes. And I also tell patients to be open with your care team too, because if there is an event that's very important to you, like a child's holiday program or a certain event, and that's, there's a conflict in your schedule with your treatment. Sometimes we can be a little bit creative with, the start times of your appointments that day or something. So just really, communicate with your treatment team and your care team, because they want you to be able to make all of those special things happen too.
Absolutely. In fact, yesterday in my own clinic, one of my conversations with my patients was, how do we strategize getting her chemo treatments aligned with a trip planned for going to Africa to visit, to climb with the gorillas. So how are we going to align her chemo treatments to get to that point? So it is true that we try to make things happen for patients, whether or not it's around the holidays or other things. So to really tell us what's important to you so we can try and set up goals. So if you're just joining us, we're here with Lizzie Wright and Lindsay Norris, and we're talking about how to support loved ones going through cancer treatment. Cameron Poindexter is here in the studio to take your questions. Remember to share this link with people you think might benefit from our discussion. Use the hashtag #BenchToBedside. So Lizzie, do you have some advice for our viewers that may be hosting a friend or family member going through cancer treatment?
Absolutely. So I think just having that conversation with the person that's coming, of, maybe having, if they're coming for the evening, having a quiet place for them to go to if it's just too much. I mean, the holidays are overwhelming for all of us, and family members included who are affected by the cancer. So I think just opening up that conversation to say, hey, what would be best? What could we tweak to better suit you? Or if they're coming to stay, maybe asking, could I go finish up your shopping list? Because we all have a hard time finishing our shopping list with everything going on. December's busy anyway. So just kind of delegating again, I think it's okay to do, even though it feels uncomfortable.
Sure. And it's also cold and flu season. So, Lindsay, can you, first of all, tell us what it means to be immunocompromised around cancer treatment for our viewers, and then also tell us what we can do to help support our patients and families when they're immunocompromised.
Yeah, so simply being immunocompromised means that the therapies and the treatments that you're on to treat your cancer have essentially broken down your defenses to some germs and to some outside exposure. So we, as cancer patients and cancer survivors and people who are caring for others who may be going through active treatment, need to be cognizant of, if we have been ill recently, you need to keep your distance from that person and wear a mask. Definitely get the flu shot, and just communicate with them if there's been an illness in the area, and using those wipes everything down. You just have to be a little bit more careful, definitely. Absolutely. Especially right now.
I think an important point you bring up is flu vaccination, not just for the patient, but also for the family and the community that they're around, because things like vaccines and personal hygiene, it's about not just protecting yourself, but it's about protecting those people around you, right? So really reminding everyone that the cancer journey is not just the patient alone, it's that entire community surrounding them, and everyone has to sort of follow those same rules and try and keep everyone safe and healthy, right?
And if they're ill too, you have to give them an out if they're not able to make an event, just like we were talking about earlier, because they're gonna want to avoid a place that has lots of crowds, especially if they're kind of battling a little sickness or something themselves.
Absolutely. So do you, either of you, have any special gift recommendations for patients who are in active treatment?
I think gift cards is always a good kind of, restaurants, they don't have to think about dinner that night, even if they're not up to eating that meal. Maybe they have young kids, they don't have to think about dinner that night. Movie gift cards, housekeeping, like something to Mary made so they don't have to worry about cleaning their house. Those are the big ones. Unscented lotions, always a safe bet.
Sure, I really liked, I was given plenty of cozy blankets to bring with me on chemo days and things like that, and it just is kind of a nice warm reminder of somebody that had been thinking about you. Also, something to remember around the holidays is, you know, kind of check yourself and say, like, am I still showing up for this person that I care about? So maybe there was a big meal train at the beginning of their diagnosis that has kind of died down. Maybe there was a big support group that was coming over and mowing their lawn or raking leaves or doing things at the beginning, but, you know, now that the holidays are here, maybe it's another good time to check in and say, you know, am I keeping up with my promise and my commitment to that friendship or to that relationship with that person going through this?
That's really an interesting point, and it's actually something that I've heard a lot from people, that at the start of a diagnosis, everyone is involved and around and sort of swarming to figure out what to do. And then as time goes on and people walk through treatment is sometimes on the course of years and a lifetime for some people. And those relationships change and people aren't sure how to continue to participate. So I love that you brought that up, to really continue to check in, because sometimes showing up and bearing witness and checking in is just as important as bringing in a present or a casserole or something like that. So what about our caregivers? So you know, it's not just our patients that are walking that journey, right? It's everyone around them that's offering them support. So how do we support our caregivers?
That's always a tough one, because caregivers are usually busy caregiving and they don't take care of themselves as much. And I know at a Turning Point we hear a lot that they feel guilty about having their own set of anxiety and worries and all of that, because they're not the one that's living with the illness. But as we know, the illness affects the entire family. It affects the children, friends, anybody that's close to that person is taking part in that. So I think just recognizing that you need to take time for yourself, and whether it's coming to Turning Point for a yoga class or meditation, or we have a group called Supporting the Supporters, where you can connect with other people who are that caregiver in that caregiver role and get support that way. So I think it's just carving out that time and knowing, again, it's the asking for help too. Like, hey, I need my friend to take you to chemo today so I can go to the doctor, and, you know, make sure that you're keeping up with your own health and getting good sleep and exercise. But it's hard to do, so.
It's hard to do.
It's very hard. I always joke that saying, like, you know, my husband was the real MVP through all of this, just with, you know, just doing double time at home and helping go to appointments and getting the kids to where they needed to go. And I really appreciated when a friend of his would step up and just say, let's go watch a basketball game, or, you know, just some distraction. And, you know, I know that he really appreciated that too, you know, taking something off of their plate when they're so busy, whether it's just picking up a shopping list, like you were saying, you know, or something like that, can be super helpful, and just let them kind of take a breather.
Absolutely. It sounds like there's so many resources at Turning Point, but then also really just thinking about grounding your caregivers and loved ones in the regular stuff that maybe they did before the cancer diagnosis happened in the family. Going to a basketball game, even taking them out for dinner, something pretty normal, but just bringing that back into their lives.
Yes.
So as we approach the end of Bench to Bedside today, you know, Lindsay and Lizzie, what key takeaways would you like our Facebook community to leave with?
You know, for one big one that always stands out that people share with the holidays is not using that holiday time to provide unsolicited medical advice from whatever crazy aunt is sharing their ideas or what they read online or something. So just you know, letting that person lead and just trying to have a normal holiday experience and just enjoying that family time together, and not, you know, coming at them with tons of questions and things like that. So yeah, just enjoying that time and being present and knowing that you don't have to come up with the answer, you just are going to be there for that.
Yeah, I would agree. Definitely normalcy is so important, just like you said, and like you were talking about. when you're going through active treatment for cancer, nothing seems normal, and so you do kind of crave those moments of normalcy. So the last thing you want to do is sit with a large group of extended family and relive that first day all over again, and relive what's been going on, and hear all of the advice and hear all of the opinions. And so just talking about those normal everyday life things is so important. And I think also if you don't be offended, like we were talking about earlier, if somebody has to leave early or change plans, and really check in with them if it's an okay time to visit. Everybody goes through this differently, so there are certain cancer patients that may want 10 people to go with them to every appointment and every chemo treatment, and there are other people who really, like me, kind of started to like the peace of it, and just, with a warm blanket and a book in a chair. And so just like you said, let them lead, and always just offer, a specific thing. Just leaving it as, call me if you ever need anything, kind of seems a little bit empty. You just be like, hey, next Wednesday, can I bring over dinner? Or, something specific, so.
I love these ideas. I have another question. What do you think about using our holidays to really explore sort of the important questions about our lives? And so something that I talk about a lot with my palliative care patients is using this time to really think about sharing your narrative and sharing your legacy, and asking you questions that don't have to do with cancer, but have to do with things like, what are the most important lessons that you have learned in your life? Or asking your family, your parents, their origin story. How did they get married? Where are they from? Learning about your family, and really taking advantage of the holiday season to get to know one another in a more intimate and really a more personal way than many times we sort of interact. What do you think about that?
I really like that idea. I think that when you're faced with a cancer diagnosis, you can't help but kind of process those, feelings. What am I leaving behind? What is the meaning of all of this? And things like that. It can be a little bit overwhelming. But if you're sitting with your close family members and you're just kind of reminiscing about your family story and things that you've done that you're proud of, and you can still have goals as a cancer patient, things that you want to do, that can be very therapeutic. Definitely.
Yeah, speaking of goals, one day, 1 week, 1 year, one lifetime, I feel like we have to have those kinds of goals for all of us. Any last thoughts?
Gosh, just enjoy. I mean, you're right. This is like, and that's why Turning Point has its name, because when somebody was diagnosed with an illness, a life-changing diagnosis like that, is a turning point in your life. Right. So just recognizing, I mean, your priorities do change, and that communicating, and not to be sorry about saying, vocalizing what you want, that your loved ones really do want to know how they can best support you. So just communicate that. Sounds so easy, but
it does. It's pretty hard.
Yes.
I think a lot of our patients are not used to sharing or asking for what they want, especially if they're women. Many times they're taking care of other people,
they're not going to want to ask for that.
So it's really hard. So we have to remind them that it's okay to ask.
Yes,
so Cameron Poindexter is here in the studio taking any questions. If there's any final questions from the audience.
We currently do not have any questions at the moment, but if you have a question, please place it in the comment box below the video, and we'll get it to our experts so they can answer it for you.
So thank you, Lindsay and Lizzie, for today. It's been really amazing to meet you both, and also to hear all of your suggestions for our patients. For more information on Turning Point, please visit Turning Point Kansas City, or it's turningpointkc.org. We appreciate you joining us, and we invite you to tune in next week, Wednesday at 10 a.m. for Bench to Bedside. Thanks for watching.